My name and first name is Jean-Michel Pawlotsky, Pawlotsky, and I'm director of the National Reference Center for Viral Hepatitis in France, in Paris. The article we are writing for the supplement is about the history, past, present, and future of chronic hepatitis C therapy, which is a very timely topic. It's a very important subject because over 150 million people are infected with hepatitis C virus worldwide. And when I started my career, we were able to cure this infection in only 6% of patients, and this was a little bit more than 20 years ago. And we have seen progress over the years with increasing rates of infection cure. And currently, with the new drugs that are coming, we are living a real revolution, and the cure rates are reaching very high levels, are unprecedented, up to 90-95%. And this will obviously change completely the landscape. And the goal of the article is to tell this story, starting from the old treatments we had, the poor results we had, and showing that with the implementation of new technologies, new models to screen new drugs, and the new drugs coming to the market, we were able to generate very high rates of infection cure. There have been many major steps in the treatment of chronic hepatitis C. The first one was the idea that interferon alpha could be, as being an antiviral drug with broad spectrum, could be used in what was called non-A, non-B hepatitis at the time. And that was started before the virus was identified, with results that were not outstanding. Only 5 to 10% of patients were able to cure infection. Second major progress, I think, was the other idea, very empirical, that ribavirin, another antiviral drug with broad spectrum, could help curing hepatitis C virus infection. And this was the first, I think, revolution in this field, because the rates of cure increased by 40%. And we were able to cure many, many patients with interferon and ribavirin. And this was further improved when interferon became pegylated and could be injected not 3 times a week, but just once a week. And then we lived for something like 15 years with PEG interferon and ribavirin as the main treatment of chronic hepatitis C, reaching cure rates of approximately 50% overall, with differences between the genotypes. And it's only more recently that new drugs came. These new drugs are direct-acting antivirals, and the first one that came to the market were protease inhibitors. One was called telaprevir, the other one was boceprevir, further increasing the cure rates by something like 15 to 20%. The problem with these drugs is that they had to be used in combination with interferon and ribavirin. The side effects were frequent, sometimes severe. There were problems with drug-drug interaction. It was not an easy treatment. So it was a progress in terms of cure rates, but not an easy treatment, and people didn't really like receiving it, and doctors didn't like using it. And now what is happening is that in 2014, 3 new drugs have come to the market. They are direct-acting antivirals. And for the first time, we can use them in combination without interferon, with or without ribavirin. Many other drugs will come at the end of 2014, beginning of 2015, and the following years. And with these drugs, we do not need interferon any longer, and we're able to cure the vast majority of patients with chronic hepatitis C, including patients with very advanced disease, pre-transplant, decompensated cirrhosis, post-transplant patients. This is really a major revolution, and this is all the story we're trying to tell in the paper. There are major challenges. What we have solved so far is how to cure HCV, and we have the tools to do that. We have the drugs, we know how to use them, and we'll have even better drugs in the future. The major challenge now is access to care. As I said initially, there is something like 170 million people infected worldwide. HCV infection is a silent disease, so most patients are unaware of their infection. So I think there are 3 conditions to provide good access to care, and we have to work on this. The first one is screening. To treat hepatitis C early enough to make sure that the complication will not occur, you have to screen patients, and you have to screen targeted populations, at-risk populations. In most countries of the world, this has not been done yet. And this is a very important challenge, because you can have the best drugs. If you don't know where the patients are, if you don't provide access to care to these patients, it's useless. Second point is that there must be a decent health care system in the country. And this may be problematic in many areas where the prevalence of HIV infection is very high, because the healthcare system, even if you screen the patients, will not allow these patients to be treated properly. And the third condition is affordable prices. And I think one of the major challenges in the future is that if we identify the patients, we have a decent healthcare system and are able to provide them with these therapies everywhere in the world, the cost has to be affordable by the local systems. Well, I think the history of the treatment of hepatitis C is a very interesting story for many aspects. Number one, it's a very short story between discovery and cure, but it's also a very challenging story in terms of dissociating all the science that led to developing very efficient and potent drugs, and real life, which is providing these drugs to patients. And I think our challenge for the future will be different. It will be less science in hepatitis C, more public health, but the challenge now is to provide these therapies to patients everywhere in the world, and there is a long way to go still.